I'm Dr. Jeffrey Britton. I'm an adult epileptologist at Mayo Clinic in Rochester, Minnesota. Today I'm going to talk about when to stop anti-epileptic medication. Once the decision to stop medications is made, the question often arises, how fast can I stop the medication? How slow should I stop? How slow should I taper off the medication? And one study looked at comparing a 9-month taper or withdrawal period versus a 6-week withdrawal period. And what they found was the faster withdrawal period led to quicker time to the first relapse. However, if one looked at the total relapse rate, it was no different in those two groups. So a longer withdrawal period merely delayed when the relapse occurred, but the overall rate was unchanged. So we usually do not advocate a prolonged withdrawal period. It seems unnecessary. I generally pick a 2 to 3 month withdrawal period, somewhere in the middle of the study that I just mentioned. Now, while a trial of drug discontinuation may not work, and a relapse may happen, studies looking at quality of life indexes have found those who try and fail, in other words, those who try to withdraw from medication yet have a breakthrough seizure, still have higher overall satisfaction ratings than those who never tried and yet remain seizure-free. I think there's an inherent nature in people that they just want to know and they want to find out. Some people just need to know by trying before they come to terms with the fact that they're taking a medication every day. So even though it may not be successful and it may be discouraging to have a breakthrough seizure, in some people I think it's helpful that may be the way for them to know that, yes, I do need to take my medication, and they're more at peace with the situation. So there's some people I think is worth considering. Another concern people have when they decide to stop medication is, if I have a relapse, will my seizure disorder be uncontrolled from then on? In other words, if I have a breakthrough seizure, will it knock the first domino into making my seizure disorder uncontrollable? Studies have looked at that question and have found that's not the case 90% of the time. Once a person relapses, they usually get under control after resuming medication. There probably is a small percent of people, though, who will remain more difficult to control after a failed trial of withdrawal. But the vast majority will not experience that, according to clinical studies that have looked at that question. What is the overall risk of a breakthrough seizure? That's another question. A person who is considering stopping medication will clearly wonder, if I have a seizure, will I have a very prolonged severe seizure necessarily? Will it lead to injury? Will it lead to serious medical consequences for me? If one looks at the overall rate of status epilepticus, seizures associated with injury, or worst case scenario, seizure-related death, the rate of such events happening during the course of monitored and prescribed anti-epileptic drug withdrawal are very, very low. So usually the consequence of withdrawal leading to a relapse of seizures typically does not have grave consequences for a person. There are risks of driving to consider if one is to stop medication, because seizure disorders clearly put a person at greater risk of a motor vehicle accident. Those questions will need to be discussed carefully with one's care provider as an important point in making a decision to taper off medication. I typically advise people who wish to stop medication to not drive for a period of time. That alone sometimes makes people decide I better take my medication because I have to drive and I don't want to take this risk. So thank you very much for your attention. In summary, about 40% of people who've been seizure-free for 2 years will have a relapse if medications are stopped. That means 60%. The trial of drug withdrawal will be successful. The overall risk of the seizure disorder being worse if a trial of withdrawal is undertaken and fails, or that a grave seizure consequence will occur upon trial of withdrawal of medication. Those risks are low. There are risk factors that help us determine who is more likely or less likely to be success. In me, one of the biggest factors is that person's life situation really helps me counsel them appropriately on whether I think it's worth them taking the risk or not, given their home situation, their work situation, etc. Thank you.